Faith has taught me so much about love and patience and the goodness in people. When I found out I was pregnant, I was 6 weeks along and there was a lot of bleeding. They did find that Faith had clubbed feet. After that, they noticed that Faith was not moving her arms and legs appropriately. They followed that with a few ultrasounds, and they discovered she had arthrogryposis, which is the curving of the joints, causes limited mobility. It can affect one joint in the body, or it can affect every single joint in your body. Prior to her being born, all they told me was that she was going to have this joint issue. So we were expecting nothing else wrong except the physical limitations. About 8 weeks before my due date, something just didn't feel right. I called the doctor and they had me come down to Des Moines to the hospital to check everything out, and she lost her heart rate at that exact moment that I happened to be at the hospital. And so we did an emergency C-section in Des Moines. Faith was really critical. She was 3 pounds, 13 ounces. And when she was 5 days old, all the information that they were giving me was I had placental abruption, Faith was premature, so she had a brain bleed, and along with the arthrogryposis and the clubbed feet and not knowing neurologically what was going on, they referred us to the University of Iowa Children's Hospital. The first person we met from the continuity of care team was Janine Pettigrew. We met her 10 years ago when Faith was born and we transferred up here. She's like family to us now. They made sure I had everything that I needed. University of Iowa Children's Hospital has the specialists and the knowledge of the nurses and the doctors that you need and that you will want as a parent to take care of your children. Faith in the last few years has developed scoliosis, and it's just been getting worse and worse with every growth spurt. She has this curve to the left, and she also has kyphosis, which means she is hunched over forward. Her breathing was getting more and more compromised. Her left side, her heart, her lungs were getting squished, her digestion, her bowels and her stomach were all getting squished. And she had a lot of back trouble, a lot of back pain, chronic back pain. And we decided 6 months after our first visit that she really needed to have the scoliosis surgery done and have the rods placed in her back to correct the scoliosis. After this last surgery with Dr. Weinstein, Faith is doing great. She can feel that it's different. The scoliosis surgery that Dr. Weinstein did, I think, has opened a lot of doors for Faith. She is going to be working on standing. We're going to be working on walking. She's going to be riding horses again next summer. She loves to swim in the swimming pool, so she's going to be very active. The way that Faith and I are treated at appointments when we come here is they treat us with such respect. They're the team that you would want to take care of your children. It's where they have the expertise, it's where they have the knowledge, they have the bedside manner. We know whenever we need to come here that we know we're not going to have to go anywhere else. We're not going to be transferred to another hospital. We know that whatever the situation is, they can handle it.